But thank you guys for joining us today. This clean practice is coming out of the manufacturing industry, but it's designed to be broadly applicable to other organizations and business needs. And while it uses lean as a framework, you do not have to be a lean practitioner to jump immediately into action. My name is Sam Pardue. I'm the CEO and founder of Endo, which is a manufacturing company based in Portland, Oregon. For a variety of reasons, we were just very early to lock into the need to protect our staff, and we created a comprehensive program for our manufacturing facility with the knowledge that while it was very important for us to disperse to remote work for everybody in our company who could do that, because we're a manufacturing plant, we needed to make a safe work environment for our production workers who remained at work. So clean practice really came out of the work that we did at Endo, and it's been really well received. We've had people all over the world downloading the documents and cluing in, and this is really going to take you through what you need to do in order to implement clean practice. So following this course, we think you will be ready to create your own organization's COVID-19 response plan. You'll be able to lead the plan implementation, lead a clean Gemba walk, which is a term from clean practice, but don't worry, it's really fun and easy. And also you'll be able to identify and implement engineered solutions in your space. So that's the goals, what we're setting out to do. We'd love feedback afterwards to see how well we did. Clean practice, as I mentioned, uses lean techniques, but instead of addressing inefficiencies, it identifies and reduces or eliminates COVID-19 transmission vectors. It provides a comprehensive system supporting organization-wide engagement. And I think that's what makes clean practice currently unique in the world. And we believe that successful implementations result in significant improvements to team member safety, but also to morale. And that's an incredibly important point that I think is really getting a lot of attention, that a lot of workers are nervous about coming to work. They don't feel good that they're being asked to come to work because they don't feel supported. And clean practice can go a long ways towards addressing that issue as well. All right. We have some disclaimers here. First, clean practice complements but does not replace aggressive social distancing. We endorse an immediate nationwide shutdown, and we want to make sure that when reopening happens, it happens with proper conditions in place. Clean practice is also based on our own understanding of lean manufacturing principles and information from the CDC and WHO on COVID-19. It is not endorsed by the government and is meant to serve only as a guide in this rapidly evolving crisis. It does not guarantee that all disease transmission vectors will be eliminated. We have had experts in public health, as well as experts in lean methodology review and give strong thumbs up to the principles that are here. We appreciate the support from the Portland leaders in the Portland Lean community, as well as Prosper Portland and OMEP. They've been very helpful to us as well. So the goals from your clean practice implementation are 0 COVID-19 transmissions in your workplace and 100% workforce participation. And we think those two things are very tightly connected. You need very broad workforce participation in order to get the very low, the great reductions in transmission potential in your workspace. So we're going to take you now through the 10 principles of clean practice. And it's all laid out in a system that is very easy for you to implement. And we try to provide template tools so that you can get going right away. One template is the COVID-19 action plan. It's available off of this link. It's available off of the website. But basically, it takes you to a template document that allows you to implement a COVID-19 plan in your workplace right away. And hopefully you guys are seeing this, but it's kind of like play. we think it's very important that you have a plan and that your team knows you have a plan. The plan provides basic information about the symptoms, so everybody's level set. There's a ton of misinformation out there, and having all the good information drawn together is really helpful. Other parts of the plan really explain, and I think this is another key thing, that there are certain individuals who are at risk of great complications. And your efforts in your workspace to create a clean and safe workplace are really designed to, most especially protect the most vulnerable team members. And that's something that you want to repeat again and again. So this COVID, response plan has guidance on when to stay at home, how you can work from home effectively, hygiene at home, and I think that's another key thing that you want to emphasize, and the steps that you'll be taking inside your factory to stay safe, and also trying to educate people on the behavior outside of the home that they need to maintain in order to stay healthy outside of the home, because one of the most important vectors, of course, is sick workers coming to the workplace and then transmitting the virus. One of the really key and pernicious things about the COVID-19 is that a very large percentage of people who are infected are not manifesting any symptoms at all, so they may not be aware that they're sick. And I'm going to try and get back into presentation mode here. Oops. All right. So I think having a plan is very important. The template is getting updated from time to time, and I think it's a really great thing that you need to have. The second part of clean practice is that you need to build trust by sharing your plan. It's very important that employees all know that you have a plan that is comprehensive and that it's going to be very visible in your workplace. The senior-most leaders need to present the plan. This is a crisis, and I think having the senior-most leaders present the plan is a way of telling everybody that this is extremely important and that we're all in this together. These are two things that will really help build the morale of your team members. During your presentation of your plan, we think it's important to lead participatory demonstration of effective hand washing. There's the old sing happy birthday twice in a row. Find the two employees who have birthdays in closest proximity to your plan announcement date and sing happy birthday to both of them. And that's a great way to do that, but do it while you're washing your hands so people see and really get a sense of what proper hand washing technique looks like. Announce zone captains. One of the key concepts of clean practice is you want to divide your physical space into zones and have zone captains who are responsible for the cleanliness of that zone. And we'll talk about that in a little bit. Emphasize, again, that clean practice protects the most vulnerable teammates. Every organization that has more than 10 teammates is very likely to have someone who's at high risk of mortality if they contract this disease. Once you get into the 40 or 50 or 100 member organizations, you have multiple teammates who are at high risk of mortality. And we want to protect those people, especially from exposure to the disease for as long as possible. And the other thing is you're going to ask people to change lifelong habits immediately, right away, starting now. As soon as this meeting ends, certain things are going to change. The things that are going to change are what you touch, what you do after you touch things, and how you wash your hands. You're going to change, and that's a big ask. Changing lifelong habits is a big ask, so it takes a lot of visual reinforcement to make that change truly happen. Everyone participates. This is really key. Leaders of the organization immediately began demonstrating best clean practices. And the senior-most leaders participate in daily facility sanitation. So at Endo, before we dispersed, my name was on the list, and I was out there cleaning various touch points in the organization to make sure that they were sterilized. And people saw me doing that, and that was an important signal to the rest of our team that everybody participates. Now, the fourth principle is to use clean Gemba walks. So I mentioned during your announcement, you're going to announce zone captains. What is a zone captain? Well, you want to divide your physical space into logical physical blocks based on the types of people, the groups of people that work in those spaces. Right here on this screen, you see this is basically adapted from the emergency exit plan that we have at Indo. Every organization should have an emergency exit plan, which basically will have a layout of your office space, your physical space. We just took that, we scanned it, and then we overlaid these colored lines on top of it to denote different zones in our space. So here's our production space. Here's the main office space. This is the customer service. That's actually my office right there. So I'm kind of next to the customer service people in the main conference room. Here's our marketing and R&D area. Broke up into zones, and then we have a zone captain assigned to each area. And the zone captain, cool area. When you do a gimbal, but don't be intimidated if you're not a lean person. It's actually a really simple thing to do. The idea is you're going to physically walk through the space and you're going to observe things that might be off. In the factory setting, you might be looking for where inventory is piling up in between workstations, or where quality issues have been cropping up, and you're going to be visually inspecting that, and you're going to be involving people from that work cell in the gimbal walk. You're going to be involving people from the area. So in a clean gimbal walk, you're going to be walking through the space. You're going to be doing it in a very systematic way. We recommend you walk in a spiral, kind of following the left wall and then going into the middle of the space, so you're very thorough and you don't miss anything. And you're going to basically, if using colored dots, you're going to put a colored dot on every spot that gets touched by hands more than once more than one person's hands in a 72-hour period. 72 hours is important because that's considered to be the length of time the virus persists on many surfaces. Multiple hands is simply because that becomes a transmission vector. You're also going to be looking for places where people are close proximity to each other, maybe passing through, or maybe just where they do their work, because you're also going to be looking for areas inside the workplace where you do social distancing, where you need to do social distancing, where you need to spread people out. So social distancing is a way to prevent person-to-person transmission. The clean practice techniques of really identifying transmission vectors are to address person-to-surface-to-person transmission vectors. Those are the two primary transmission vectors for COVID-19. And so you walk through your space. When you find a transmission vector, which could be a light switch, it could be an on-off switch for, say, a microwave oven or the control panel of a microwave oven, doorknobs, conference room table surfaces, the conference room chairs, the remote control for your TV. You're going to put a colored sticker on it, and the colored stickers are going to be the color of the zone that you have. So you're going to need, this is the one expense of clean practices, you're going to need to buy some colored stickers, different colors for different zones. And then you put the stickers on the touch points so that they're visually identified. And that's really important, and it's going to be really handy because it's a way to communicate that this organization is really on top of this issue. You're also going to want to document what you find, and we've provided a template. It's a Gemba Walk template, we call it. And what it allows you to do is basically, it basically explains how to do the Gemba Walk. This is available off the website as well, and you can download it yourself. But it also has a place for you to mark down your supplies inventory so you can keep track of your cleaning supplies. Make sure that you don't run out. Some of the lead times on some of these things are very long. And you create your cleaning schedule. So you're going to be noting the locations. Say this might be doorknob number 1, or the office room doorknob, and you're going to have the initial this upon completion of the cleaning. And so this is a Gemba Walk example from Endo. The plant water bucket, yes, of course, multiple people touch that, and we need to make sure it's clean. And as you go through, you're adding the owner to it, and you're tracking the execution of these deliverables. So that's basically what the Gemba Walk is. It's a survey, a visual survey of your space. It's a visual marking of your space, and it's recording of all these locations. And that's the documentation stage. Now, visual factory is another idea that comes out of lean manufacturing, but it's really, I think, very applicable to this. You see all these colored dots. And the colored dots, visual factory, the idea of visual factory is humans are visual animals. We get so much of our information from what we see. We evolved to be like this. The visual factory is a way in the manufacturing space to make it easier to train people and make it easier for people to follow processes with great reliability and rigor. And in this case, you can see that we've put these colored dots next to all these points that need to be cleaned on a regular basis. Maybe it's every day, maybe it's even more than every day for surfaces that get touched a lot. Maybe the microwave oven actually gets cleaned every time it gets used, because you just want to make sure that that doesn't become a disease transmission vector. But all these dots everywhere are basically reminding people that you have a great rigorous practice in place to keep them safe. And so even though they look different, they look odd, that oddness is an important visual signal to your team that's really going to boost their morale and let them know that there's a rigorous system in place to keep them safe. It's also going to make it much easier for people who go through and do the cleaning to make sure they hit every single spot without missing it. And that, we think, is a really important element as well. We also think that you can have really cool signs, that basically reinforce a number of key behaviors. The hand washing behavior is really an important one, that you have those posted in your bathrooms. Maybe on your entrances, you have signs posted that if you're feeling sick, you are not to come into the workplace today, you're to go home. Or if you start feeling sick while you're at work, that you are to go home immediately. I remember back on February 27th, before we had the first community transmission documented here in the Portland, Oregon metro area, our director of R&D had been feeling a bit ill for a couple days. But he had an important meeting at work, so he came in because he's a strong team player. And at the end of that meeting, he coughed a couple times into his elbow, and then I immediately asked him to go home right away. So he was only at the work hour before I asked him to go home. And that really is the kind of standard that you want to have implemented. It turned out Tim got, at least had bad bronchitis. There's never been any testing available for him, but he was home coughing for several weeks. And in fact, we transitioned directly into our remote work mode without him ever coming back into the office space. So Tim, maybe he had COVID-19, but we haven't had any other transmissions in the factory. If he did have it, we cut short his ability to transmit the virus inside of our workplace, and by having him immediately go home without any hesitation. And I think that's one of the fundamental principles of what COVID-19 asks of us. It asks of us to take action sooner than we might otherwise take it. Delay is very, very costly in an epidemic. The delays that we faced at the federal level, I think, dramatically slowed down our implementation, and that really hurt the United States in terms of the overall spread of the virus. So the faster you implement in your workspace, the better the results are going to be for you. And cases that are eliminated today result in many fewer cases down the road, because that person who doesn't get sick doesn't have the chance to infect other people and pass it on. So PlanDoCheckAct, this is another idea from lean manufacturing, but it's very, very applicable here. And it kind of, really refers to or reinforces this idea that you're going to have a really tight cycle here. You're going to create a plan. That's really important. You're going to begin implementation the day you present the plan. And I think that's also really important. And that implementation can be the appointment of the zone captains and your first Gemba walks around your space to really identify social distancing opportunities and transmission points that you need to address. But then you're going to check you're going to make sure that the cleaning is being done. And the great way to do that is to post, as you can see here on this slide, cleaning schedule, and have it initialed every time it's done. I highly recommend that everybody in the organization participate in the cleaning schedule. Everybody needs to participate in clean practices at home and at work. By having everybody participate at work, you're signaling to your organization that we're in this together, that we all need to contribute in order to get that great outcome, which is 0 COVID-19 transmissions inside your space and 100% workforce participation. So check that everything is being done. Rotate the participation amongst different employees. That makes it very low impact on them. And again, acting as senior leaders, demonstrating best practices and ensuring that everybody's actively participating. I often would, before we were dispersed, I would drop in on meetings, and this is going to be now referring to actually once we go back to the office place. You check in and you ask people, how well are you maintaining these new practices that we've asked you to do? It's about demonstrating at the kitchen sink that you're washing your hands for a good full 20 seconds and letting everybody see that, and maybe even drawing attention to the fact that you're doing it. It really communicates the seriousness of intent. And I think that's, the idea here is, we started developing a lot of practices before we dispersed. But the nation is being called upon to get back to work. Once we go back to work, it's very, very likely COVID-19 is still going to be circulating widely in the population. So it's going to be very, very important as we go back to our physical workspaces that we maintain these practices in order to prevent a resurgence of the disease. So Kaizen, the concept of Kaizen in Lean is continuous improvement. You're constantly re-examining processes to see if there's a better way to do things. And the first Gemba walk is really to identify issue points. That's the first effort. But we recommend doing a second Gemba walk shortly after the first. But the idea on the second one is to go beyond identifying issues. It's going to fully resolving them. A great example of this is your refrigerator door handles, right? They force you to touch their door with your hands. There's no other way to open up the refrigerator door except with your hand, but that's no good. You can actually install these inexpensive devices which will allow you to open the refrigerator door without your hands. And that eliminates or dramatically reduces the transmission vector altogether. So we have other examples. That very first slide had a little hook. We actually took the doorknobs off of our doors and we put a hook, it's basically a coat hook that you can get from Ace Hardware, which allows you to put your arm through the hook and pull that door open without having to touch the doorknob. There's things like that are really the next step, because you want to eliminate every hand-to-hand kind of, the more things that people don't touch with their hands, the better. Operating light switches with your elbows, training people to use, cough into your left elbow, operate, doors and light switches with your right elbow is one good way to train people. So, but on the second Gemba walk, you're looking for opportunities for the engineered solutions, which are, physical changes to the workplace. A great idea is to cross-pollinate teams. So if you've broken up into multiple zones, you invite somebody from a different zone to walk through your zone the second time because they may see something with their fresh eyes. You identify opportunities to eliminate disease vectors altogether wherever possible, because washing hands and cleaning surfaces one a day is not enough. We want to go beyond that wherever possible to eliminate disease vectors completely. Expanding trust by extending protection to all your workers is an incredibly important part. Federal legislation in the United States has addressed this to a certain extent. Sick employees coming to work are the most important, one of the most important, maybe the most important vector to address, right? Because if sick people stay home, then they're not bringing their illness into the factory to spread all over the place. So that takes maybe a complete shift in mindset around kind of this lack of trust situation, which organizations are often in, into a position of trust. You need to trust your team not to abuse the new paid time off policies that are being made available. The organization, many organizations are going to be under great stress. We need to emphasize to our team members that the extension of extra paid time off is something that the organization is doing to support them. But we need the team to support the organization by coming to work if you're well. Because as more people get sick, it's going to be important that the people who are healthy come in to keep the organization going. This example, sick leave policy predated the new federal regulations, but the federal regulations require an offer of 80 hours of PTO, paid time off, to all employees. This, you might consider supplementing that if it's a respiratory illness. A lot of times the recovery period is longer than 2 weeks. You may consider extending PTO for people who are showing the symptoms of COVID-19. So trust is such an important element in a successful organizational response. Accountability. This is really important too. It's always important in any organization, but I think with this one, there's a sense that it doesn't matter what your grade is or your rank in the organization, your title. We're all in this together. The CEO can get sick just as quickly as a line worker. So we need to communicate the status of company-wide participation. When we brought forced at meetings, how many of you are now washing hands twice as long as you used to? Well, okay, a bunch of people will raise their hands right away because people are taking this really seriously, because they see your organization's taking it really seriously. The people that haven't started changing their hand washing behaviors are going to see that everybody else is really changing their hand washing behaviors. And so maybe they'll raise their hands and they're not completely honest about it, but seeing that everybody's changing their behaviors will actually encourage them to actually change their behavior in a positive way. Again, leaders demonstrate best practices daily in front of your teams. You emphasize participation by all employees, enhances the safety of all employees, especially the most vulnerable members. That is a really key element of clean practice. And growth. Growth is the final element of clean practice. And the idea here is that you want to expand the practices beyond the factory. You want them to expand into the home. And that may seem like a really tall challenge, but really it's the only way to make sure that people are not going to be bringing the disease with them to the workplace. Because with a 5 to 6 day incubation period from exposure to the onset of infection, and with up to 50% of the people who are actually infected not showing any symptoms, the best way, but still transmitting the disease, it's really important that we try to expand the realm of safety and clean practice all the way to the home, and make that a subject of conversation that you have periodically with your team. In our case, we have multiple people in our organization that live in shared homes. So Portland has expensive rents. So a lot of people might live in a shared house, 4 or 5 roommates. Well, you kind of need to make sure everybody at home is on the same page. And this is a photograph from one of our employees' homes where they've used a clean gimbal walk in their space, getting everybody in their house to be very aware of what are the transmission vectors in our home, putting the dots, creating a cleaning schedule, doing all the smart things at the home. Now, that employee, because he lives in a clean home that's using clean practices, is much less likely to bring the disease into the workplace. Now, we also want to be really ambitious here. We want to go beyond just the home, and those 4 or 5 people that share that house with this Indo employee, a lot of their employers were not actually maintaining, they didn't have their own COVID-19 plan. So maybe those workplaces are not as safe. But Now this employee has shared the clean practice templates with his housemates, and his housemates can bring in a COVID-19 action plan into work, a template, and say, hey boss, I have this. I think it's really important that we have a plan, and here's cleanpractice.org. This is really simple. It's really fast to implement, but it's very visual, and it really has been helping Endo have a much better team morale. I'm really happy to report that we have not had an attendance issue at Endo thus far. We have not had disease transmission at our factory thus far, and we're super grateful for that. But I believe that this is a numbers game, and you need to work down all the potential factors and reduce them everywhere you possibly can. And that happens through structural, physical changes you make to your workplace, and it also happens through behavioral changes that are really important for people to do, not just at work, but all the time and everywhere. Now, there's some further information on social distancing that I'm going to bring up here in just a minute. I'm going to stop sharing. I'm going to bring up this new document, and I'll be right back. All right. So I'm going to show you now some examples of social distancing in the workplace, which is a great and very important element to clean practice. It's actually separating physically people from each other in the workspace. So Christina, can you see the key elements to workplace social distancing?
Yep.
Okay, excellent. So key element here, everyone wears masks. You're minimizing the people at work to those who have to be there. You're maximizing spacing with a minimum of 6 feet apart. This is really hard for manufacturing people because you typically want to get people really close together because it makes it efficient to pass parts and projects physically through space. But here we're going to do the opposite. We're going to spread people out. We're going to limit the headcount in common areas. We're going to reduce meetings and meet outside whenever possible. We're going to use physical limiters and separators, and we're going to stagger shifts and breaks so that people are not concentrating physically in the space. And we're going to provide paid time off before and after breaks for hand washing. This is really important because you want that behavior change. You want everybody coming onto their break to wash their hands, but you can't actually use up the entire break with people waiting for a scarce resource, which might be the sink. So you need to let people start coming off work to wash their hands before their actual break time starts. So here's an example of how a company here in Oregon has minimized or maximized spacing with a minimum of 6 feet apart. They've actually used painter's tape to mark out work cells to keep people far apart from each other. You see this outside of grocery stores now. You just take the same kind of concept into your workspace. You limit headcount in common areas. So you see this conference room only has 4 chairs in it now. It probably had 6 or 8 chairs before. But now this is physically actually limiting the number of people who can sit down around this table to make sure that we are spacing people out properly. Meeting outside is a great idea because any airborne aerosolized transmission is going to be dramatically reduced if you're outside and you have fresh air ventilating through. Physical separators and limiters, that example is taping up a actual wall to kind of keep one area apart. Below that, you see a photograph of some conference room chairs that have been taken out of circulation so that you physically can't allow people to sit, too many people in a conference room. So it's kind of reinforcing the limits to the number of people in the conference room at a single time. And so those are all great examples of social distancing. The idea here is that you can get started today. This presentation doesn't take very long. Neither does implementing these practices in your workplace. With that, I can say that we are going to be sending out a survey after this, and it's actually popping up right now. We are going to ask you to answer right away. If you think your organization is going to implement elements of clean practice, can you guys answer that survey for us, please?
And while you guys are answering, please feel free to type any questions you have into chat, or let us know what you're doing if there's any other questions that you guys have.
So one question we got is about the physical engineered solutions. And the question is, are there any products on the market today that will allow, say, hands-free operation of things in the workplace? That's a great question. I know at Endo we've invented a bunch of things. Like we had some toilets that you can only flush with your fingers because the flush buttons are just level with the top of the back of the toilet. And we removed one of the metal buttons and we put an extender, which you can now flush that toilet with your elbow. Not having to touch it with your hands is a big step in the right direction. We've been working on doorknob adapters to allow you to open doorknobs without your hands. And we actually are, because we've come up with a really good design that is very easy to implement, very fast to install, and it's completely reversible once this crisis is over. We're going to make those available at a very reasonable cost. If you're interested in getting those, please drop me a line. We could help equip all of the doors in your facility to make them operable without having to use your hands.
Awesome, great. And I just wanted to send out one more poll to you guys. As Sam said, we're an organization that really takes lean to heart, and that includes this webinar even. So I'm sending you a poll right now asking how we did. We'd love to hear your feedback. If you could please just give us an indication. This will help us improve it for future presentations.
Awesome. While you're filling that out, we really want to try to make the materials available through Clean Practice more widely available. We have the templates on the website. The biggest challenge we face right now is actually getting the word out and letting more people know about this, and really demonstrating that we have something that's valuable to other organizations. We've heard that what we're offering really is, but being able to show that to potentially grant funders or something like that would be extremely helpful. We are interested in working with business organizations or doing presentations for networks of businesses. So OMAP is going to enable us to do a presentation to their membership network. That's a great way for us to get the word out very quickly to a lot of different companies. We're looking for other kind of business organizations that we could work with to provide this helpful information to people.
Great.
Any other questions so far, Christina?
No, I think that's it. Thanks everyone for joining us. If you want to join in on the conversation at a later point or share your successes, we have a LinkedIn group that is available on cleanpractice.org. We'll send it out in our follow-up email. Please make sure to join. We'd love to hear from you to continue these conversations.
Awesome. Well, thanks everybody. Clean Practice is fast and you can literally get started today and make a big difference in your workplace. Thank you.